The people here actually take an interest and follow up.
Spaulding has a uniquely strong commitment to the disabled and to those who need access to this sort of long-term health care.
Commitment, passion, caring, world class. Ask most how to describe the Spaulding Rehabilitation Hospital, and this is what you'd hear. Spaulding began in Boston in the early 70s. From then to now, the changes have been stunning.
We went from a facility that was really much more of a perhaps caretaking environment to one of the truly great integrated research and clinical care places in the world.
Spaulding has become a world leader in helping people recover from a devastating illness or injury to help people who have had a challenge in their lives restore their lives. Today, that is happening at one of Spaulding's more than 25 inpatient and outpatient centers in eastern Massachusetts, including at their anchor clinic, hospital, or facility, which opened in 2013 in Charlestown.
We moved to a building on the water with views of the water that was adaptively designed, where we sought a lot of input from our patients. It's unquestioned that this lit, bright environment with so much more technology and elements for people with challenges made an incredible difference.
There, it is treatment and rehabilitation. One example of that is Spaulding's adaptive sports program, which includes kayaking, rock climbing, and skiing. Several professional athletes have received care at Spaulding, but you don't need to be on that athletic level to get it.
So many people who have elbow pain, shoulder pain, knee pain after running, people training for the marathon, people cycling, as so much of our community does over the weekend. We have the weekend athletes, all of whom we're seeking to restore to function.
Spaulding is also a teaching hospital for the Harvard Medical School. It's a critical connection.
We have an incredible number of medical students and trainees, our medical trainees, that really are the source of our lifeblood.
Whether it's a first-year medical student or a seasoned physician, there's one common thread.
It's passion, and it's a passion for the patients. That could be someone in the research lab who is there passionately late night working on a project to say, hey, can I make a difference for people with spinal cord injury? That could be a nurse caring for a person with an injury. And so it is our entire team that just is so ensconced in the patient population, because they know that they feel responsible for changing those people's lives.
There are countless examples of that passion to help. One of them came in the moments and the days following the Boston Marathon bombing in 2013. Nearly 36 bombing survivors received treatment and rehab at Spaulding. The following year, staff and friends of the hospital ran the Race for Rehab, raising $750,000. Sports medicine is a huge part of the network's commitment.
How do we restore athletes to their function? How do we do that for runners, cyclers, the aging athlete, or the geriatric athlete, a special emphasis on women as athletes?
Spaulding is quite proud to be a recognized leader in rehabilitative medicine, both here at home and around the world.
There's so much that we have in this Boston community, in the world community, that has allowed us to now bring sentinel biotechnology to our patients in real time. And we're able to change their path. We see people walking who've never walked before. You see people speaking who would have never done that before. You see people getting out of pain who would have never done that before.
So what's next for Spaulding?
I think we have huge potential in the area of robotics, in the area of pharmacologic therapeutics, in the area of understanding how we retrain people in the optimal time.
Cutting-edge facilities, treatments, therapies, all likely to modify and change as time goes along, but there's one thing at Spaulding that will stand the test of time.
It's the one thing we select everyone here for, and it's the one thing I can't teach. I can't teach people to care. Everyone here is incredibly passionate about the patient population, about transforming their lives, and about making everyone one day better every day.